Sometimes the greatest danger does not come from a single disaster, but from two unfolding at the very same time. Across Bangladesh, that is the reality confronting millions of families as two very different diseases threaten lives, overwhelm hospitals and test the country's public health system. Dengue, a disease carried by mosquitoes that flourish during the monsoon, is once again beginning its seasonal climb. At the same time, measles, a disease that many believe modern vaccination programs had largely brought under control. It's spreading through vulnerable communities, placing thousands of children at risk. They are different illnesses with different causes, but together they create one growing emergency. Every cough, every fever, every sleepless night now carries a new layer of fear for parents who simply want to keep their children safe. Doctors are preparing for wards to fill, nurses are working longer hours, and health officials are racing against time to contain two outbreaks before they grow even larger. Behind every daily statistic is a family waiting for good news, a hospital bed that may already be occupied, and a child whose future depends on receiving the right treatment at the right moment. These are not just medical challenges, they are deeply human ones. They remind us that public health is never only about medicine, it is about trust in vaccination, clean communities, early diagnoses, strong healthcare systems, and governments that can respond before emergencies become tragedies. Bangladesh has shown remarkable resilience through floods, cyclones, and previous disease outbreaks. But resilience should never be mistaken for invincibility. Healthcare workers cannot carry every burden alone, nor can families facing hardship be expected to overcome these challenges without support. As monsoon rains create fresh breeding grounds for mosquitoes, the risk of dengue grows with every passing week. Meanwhile, every child who misses routine immunisation creates another opportunity for measles to spread further through schools, neighbourhoods and communities. The greatest concern is not simply that two diseases exist at once, but that they compete for the same doctors, the same hospital beds, and the same medical supplies, and the same exhausted healthcare workers. That pressure can ripple through an entire healthcare system, delaying treatment, increasing risks for everybody. Yet, this story is not only about illness, it is about responsibility. It is about removing stagnant water before mosquitoes breed. It's about recognising symptoms early instead of waiting until they become severe. It's about ensuring children receive life-saving vaccines and understanding that prevention remains far more powerful than cure.
History has shown that disease outbreaks rarely affect everyone equally. It is often the poorest communities, the youngest children, and those with the least access to healthcare who bear the greatest burden. That is why the convergence of dengue and measles presents such a profound challenge. One disease spreads through mosquito bites, the other through the air, but both exploit gaps in protection. Crowded neighborhoods, interrupted vaccination programs, limited access to healthcare, and changing weather patterns all create conditions in which outbreaks can accelerate. For families already struggling with rising living costs, the emotional and financial strain can become overwhelming. A simple fever may mean missing work, traveling long distances to find medical care, or facing uncertainty about whether treatment will be available. At the same time, hospitals must prepare for increasing demand while ensuring other patients continue to receive essential care. This is a reminder that public health emergencies extend far beyond hospital walls. They influence education, livelihoods, economic stability, and public confidence. The encouraging reality is that many of the most effective solutions are already well understood. Vaccination protects children against measles. Eliminating standing water reduces mosquito breeding. Early medical attention can prevent severe illness and save lives. Public awareness, community cooperation, and timely government action remain among the strongest defences against both diseases. The challenge now is turning knowledge into action before today's warning becomes tomorrow's national emergency.
The weeks ahead will be crucial. As rainfall increases and mosquito populations expand, health authorities will be watching closely for signs that dengue cases are accelerating or not. At the same time, efforts to strengthen measles vaccinations and improve disease surveillance will be vital in slowing the spread of infection. The outcome will depend not only on hospitals and government agencies, but also on communities taking practical steps themselves and one another. Every vaccination delivered, every breeding site removed, and every patient treated early represents an opportunity to prevent further loss. Bangladesh has faced immense public health challenges before and demonstrated extraordinary resilience. The hope now is that swift action, public cooperation, and sustained investment in healthcare can prevent this dangerous convergence of outbreaks from becoming larger humanitarian crisis. This is Breaking Silence.